Action! Hey everyone, Pedro had a question about prostates. The prostate is the male gland and it sits at the base of the bladder. And this is November, it's Men's Health Month, so I thought I'd do a video for this. I actually owe Tim a video on how to eat for cancer, and that involves prostate. But for now, if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So this is a schematic of the bladder and the kidneys and the ureters and the urethra. The penis is essentially what houses the urethra. The urethra essentially takes the fluid that sits in the bladder, and when you're ready, it jettisons it out of the body. These are the two kidneys and the ureters that drain the urine into the bladder for when you're ready to go. The kidneys are solid organs. If you've ever seen a kidney bean, that's kind of like what it looks like. They're solid organs that take blood, filter blood, get rid of stuff you don't need, and the bladder is just a vesicle or flask for holding a certain liquid volume until you're ready to get rid of it. This black thing here is the prostate. And the prostate sits at the bottom of the bladder, and it's like a small, let's just say it's like a small round thing. It's a gland, and so you're supposed to hold semen or sperm, and then the sperm mixes in with the semen. It sits in the prostate, and when you're ready, it lets it go. That's essentially the basics of it. So this is how a prostate's supposed to be, nice and smooth and small. This, if you can imagine, would be the bladder. And if the bladder, which is a muscular organ, it's a muscular organ. It has a sense of contraction, it has a sense of stretching, but it's made of muscle, so that when ready, the muscle can be used to squeeze all the fluid that you're holding out through the urethra into the toilet or on a tree. So the idea is that this muscle, this vesicle, has to be able to stretch to accommodate for a collection of fluid. Now you would figure something as round as a small prostate in comparison to this bladder shouldn't have any problems. But remember, when the bladder sits on top of this thing, you can fit that and it won't bother and it won't take up that much space. That's how it looks. The prostate sits like that. The bladder is around it. So you can imagine that when you have a small prostate as you're younger, it doesn't take up that much space and it doesn't irritate the bladder. The bladder can enlarge around it. And remember, the bladder it's a muscular organ. It can stretch, but it also collapses. Like a balloon, when you don't have any air in it, it collapses to be tiny. The best I've seen for some guys who have a neurogenic bladder or a blockage, I've seen 1,000 cc's been held in a bladder where some people had to go, but they couldn't go because there was something blocking the way, and they had to get a catheter put in. The way a catheter works is you stick this tube through the bladder and it sits in the prostate, into the urethra through the prostate and sits in the bladder. That way there's no blockage and you just happen to pee. Now the problem is this prostate does get big, and big is usually the issue with prostates, especially as you get older. A gland will always get bigger and scarred and inflamed, and when the gland gets bigger, it takes up space. So imagine this round little prostate getting to this size, and that's obviously going to take up more space in this relative expanded balloon. Now, I can't do this, but imagine where it was before, and now you have a large thing that sits in almost a quarter to a half of the size of the balloon. So if that thing is taking up space because it enlarged, as you get older it enlarges, then there's not that much room to hold the liquid or the urine. And if there's not that much room because the bladder has this big coconut inside of it instead of a tiny knob, then you get the urge to pee a lot faster than before. If the max, like I said, is about 1,000 cc's, Well, if you have something that's taking up or occupying space and you bring it down to about 500, you'll have to go more often. That's why older men have to pee more often during the day, and that's definitely why they pee often at night. I have a lot of guys that in their 70s and 80s that say they have to pee about every 2 to 3 hours at night. Now, it could be because of the prostate enlarging. It could also be because this large gland went from smooth and tiny to big and irritating, nodular. And when it's nodular, it can actually irritate the soft, smooth muscle of the bladder. So when you have something irritating, it tends to empty, or the muscle tends to contract faster. If you're low on magnesium, if you have anxiety, then muscle cramps and fasciculates. Whether it's the heart muscle and you have atrial fibrillation, or the calf muscle or the bicep muscle, you have muscle cramping. When you don't have enough magnesium or you don't have enough sleep, those muscles don't work right. Same thing with the bladder. Bladder, when it distends and it is irritated or in the presence of low magnesium, the muscle turns to cramp, and whenever it cramps, it contracts. That's all muscles do, is contract. And it'll give you, without necessarily having an enlarged full-size capacity yet, it'll give you the sense that, oh, I gotta go. So the muscle, if it's irritated, even if you just have a drop in there, if the muscle's irritated, it'll make you go or have the urgency to go, and then you won't pee as much. If you have a full bladder, relative to before, if there's just a space-occupying lesion in there and your bladder is full, no matter if it's 500 cc's of fluid because of that space-occupying big prostate, or it's 1,000 cc's when you're young, you'll have the sense that you have to go. You go ahead and relax, and these muscles inside let you pee. And you can empty it out 100% and hopefully start to accumulate more fluid until the next time you have to pee, which should be about 6 hours later. I think we as Americans don't drink enough fluids. As a society, I think we're dehydrated because when we work, nobody wants to take time to pee, so we tend to hold off on fluids. That's why in the wintertime, November, I think a lot of people are dry and itchy because they don't take enough fluids, and as the weather changes, you'll notice it more. Check out my video on winter itch. Also, with sinuses and clearing the snot out for allergies of the season, we don't do a great job because we're usually a little bit on the dry side. Having said that, when you have an enlarged prostate, we always have to worry about this enlargement possibly being, it could be from scar tissue. If it's scar tissue and you're just getting older, fine, you just have to deal with it. But if it's taking up space and the bladder, the urethra that empties the bladder, that tube that empties the bladder and goes out the penis, it penetrates through this prostate and goes through it. So if this prostate enlarges this way, it also will choke the stream of the urethra, making it difficult to pee. So if you have an enlargement, then you have to deal with it. It's called benign prostatic hypertrophy. With benign prostatic hypertrophy, or BPH, we sometimes can use medicines to shrink the muscles around here. And if you can shrink this a little bit, you won't have as much of a problem peeing at night. But the biggest problem, and that means you'll be stuck on tamsulosin for the rest of your life, the biggest problem would be that if this large, scarred up, inflamed tissue is actually cancer. And that's the controversy now, because we can check the way this thing feels by doing a rectal exam, and you can feel the prostate if it's nodular, if it has a spike on it, or if it feels not necessarily like an enlarged prostate, but more like a cancerous growth. So by feel, we can say that doesn't feel good. By blood testing, there's something called a PSA, prostate-specific antigen test. And the PSA, we used to get it every year to see and watch when the PSA would elevate. So as the prostate grew to a large size, the PSA would also grow higher. So it would signal to us that you have a potential cancer that we have to worry about. Usually by the time the PSA grows or increases, the patient usually has urgency every night, and stream is decreased, and dribbling occurs, or sex is difficult. Usually most of my guys know. However, in some cases where it's not felt, we can screen it. We see an elevated PSA level, and or an increase in, not necessarily a high PSA, but an increase in the speed at which it doubles. When you have those two things, then we have to check you out with an ultrasound. Yes, it has to be through the rectum, and we try to get the texture of the prostate. And if it looks cancerous, you need a biopsy, no way around it. The only way to really test if this thing is turning cancerous after diagnosis, which is usually ultrasound, it's first by feel, and then it's by PSA blood testing, then it's by ultrasound, sometimes even an MRI if you can afford it, but that's like $5,000 test. So once we find that this thing is enlarged, then we take the ultrasound through the anus. The same ultrasound is used to get right next to the prostate, and then you'll hear needles. Needles, it sounds barbaric, but it's the only way to get tissue from this thing. You'll hear a bunch of needles being pushed into the prostate, and a tiny microscopic biopsy of the tissue is taken out. I've never had one done. We'll knock on wood, coconut. But most of my guys that have them done, they'll hear a tap, 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 because the machine makes that noise. And I guess when you have something stuck up your butt, there goes my prostate. When you have something stuck up your butt, you can probably feel it and hear it, and you're probably anxious to begin with. So it's very, I guess, invasive, but you know what? Women go through pap smears all the time, so guys, deal with it. However, once we have the tissue back, if the tissue is all negative, then thank God it's not prostate cancer. But in many cases, and we just watch you via blood testing, feel, and symptoms every year. Urologist is usually best at doing that, but your primary care doctor could do it too. The problem is if we get a biopsy back and it's prostate cancer, it can go from anything that the beginning of prostate cancer, that's prostate cancer in situ, all the way to well-differentiated aggressive prostate cancer. And the only way to tell is through the biopsies. But in the last decade, because research has found that the guys that had the most aggressive forms or any form of cancer, we would just cut it out with radical prostatectomy. That's essentially taking this prostate and cutting it out. Used to be able to do it through the scope and kind of rotor-rootering in the prostate, get enough tissue and clean it out from the inside, but that would usually leave guys with incontinence and sometimes leave enough cancer tissue to continue on. So then doctors moved to get the whole prostate out through a big incision in the belly, taking out lymph nodes, and pretty radical. And so that's why it was called a radical prostatectomy. But even with all the radical prostatectomies, the patients still live to the same degree as the guys who didn't have the surgery. So now the objective is usually it's something called active surveillance, where you find the diagnosis, you make it through the biopsy, and we just watch you. So it almost has been downgraded as far as the value of checking the prostates. That's by the U.S. Preventive Services Task Force. So I won't get into all the grading scales of that, but I think the most important thing is to understand what happens when you have the urgency as you're getting older, and then what happens when doctor tells you, well, it's not a cancerous thing, so we'll just watch it for now. But I'll put a second video out soon on what to do when you have prostate cancer in situ, or an early prostate cancer, or if the doc said, you have prostate cancer, we're just going to watch it. I wouldn't just watch it, because urologists are really good at surgery, so they're good at watching. And then when you turn positive, or when it grows, or when it accelerates and becomes an active bad cancer, then they'll cut everything out, give you chemotherapy and radiation. My suggestion is that you make lifestyle changes. And yes, I think even if you have prostate cancer in situ or well differentiated, there are some studies that show that if you reverse your inflammatory condition, that the prostate cancer can reverse. And I've referred to it before in my other videos on heart disease. Dean Ornish's lifestyle preventive project has found that the same active vegetarian, low-fat, group therapy, exercise, yoga, mindfulness practice that he suggested for people with heart disease, actually the program was used for people with prostate cancer in situ, and it reversed the prostate cancer. So it goes to show you that the proper choice of healthy lifestyle can be used for heart disease, for cancer, And I'm sure for stroke sooner or later, just have to see if the studies support that kind of use. So it ain't gonna hurt to make a lifestyle change. And my suggestion, Pedro, is that if we're just watching, don't just watch. Let your doc watch, let me watch, but actively change your lifestyle to be as healthy as you can be, even if you have, even if you're in 50s, 40s, 60s, 70s, I'd still say it's worth it to change. Because one thing for sure, that this thing, if it continues to grow, it will cause suffering. It will cause interruption. And we try to avoid that with as best a conservative treatment as possible, and I think lifestyle change is it. Now, you don't have to be vegan, don't have to be vegetarian, but you do have to get away from crappy food. Standard American diet puts us into this crap to begin with, so if you can just stop what you did before, go a different route, let me help you or get a nutritionist to help and develop some kind of mindful practice, I think that you're on your way. So good question, Pedro. For the rest of you, I appreciate you watching up until this point. Don't forget to subscribe, and we'll see you in the next clinic.